Anesthesia delivery with syringe adapter for miraDRY. The syringe adapter is a small plate consisting of 5 to 7 small needles. Each needle size is 30 gauge and 4 millimeters in length. The use of small tubing connecting the syringe adapter to a 20 cc syringe is recommended for easy delivery of the fluid. Step 1. Outline the treatment area. Based on the hair-bearing area of the underarm, outline the treatment area using a marker. When needed, the sizing tool can be used to assist in outlining the treatment area. An approximate length and width of the treatment area will help determine the needed volume for anesthesia administration. Step 2. Clean the treatment area thoroughly with chlorhexidine or povidone iodine. Insert evenly in the center of the treatment area. Starting in the center of the treatment area, place the syringe adapter evenly across the skin and insert all needles at the same time. Step 3. Administer a 20 cc bolus of solution. Inject the solution to administer a 20 cc bolus. The swelling and blanching of the skin will give an indication of the spread of anesthesia. If needed, the table can be used to leverage the delivery pressure. Step 4. The next 2 steps for delivery should be the superior midline and inferior midline portion of the treatment area, injecting 20 cc's of solution for each placement. Thereafter, the syringe adapter can be placed in the lateral and anterior portions, injecting 10 cc's for each placement. It is important to note the area should be cleaned prior to injection. Always follow the total recommended volume for a given treatment size. Step 5. Size and template as recommended. Size the treatment area using the sizing tool and a marker. Based on the measured treatment size, apply the appropriate skin transfer. Use gauze and alcohol to transfer the ink. Apply slight pressure to ensure the ink transfers onto the skin. Remove the gauze and then the transfer. If needed, use a marker to fill in missing marks that did not transfer. The template booklet can be used to verify marks. Follow the pattern on the skin transfer to administer miraDRY in the treatment area.
In terms of when we were injecting, did it feel like a bunch of needles or just one needle?
It felt like one needle.
All right. And when we did the first one with the ice, how much did you feel? Did you feel a little pinch or nothing?
A little pinch.
A little pinch. On a scale of 0 to 10, 0 being absolutely no pain, 10 being the absolute worst pain in your life. Where would you put the pain?
Like 2.
Okay.
1. I don't know. I'm really bad with needles though. So.
All right. So you have a real fear of needles.
Yes.
Because they hurt, or you're just scared of them?
Scared. And then I make it seem like they hurt more.
Okay. And in terms of what we use today, did we kind of address that fear? Did it kind of alleviate
yeah,
it?
it was fine.
There was no issues?
Yeah.
All right. Now, after the initial injection and we massaged the numbing fluid and kind of spread it, how many of those additional injections did you feel? So I did another 8 after that first one. Did you feel 8?
One? No.
Did you feel a few? I know you felt a few on the lower.
Yeah, like 2 or 3 like tiny pinches, or the one,
after the first one?
Yeah.
Okay. So.
But most of them I couldn't feel at all.
You couldn't feel it all. So really you felt the first one, and then maybe out of the next 8 you felt maybe 1 or 2, possibly 3 of them, but they were
like
tinier
tiny,
pinches, and
yeah.
they were equal to less
Way
than the
less,
first?
yeah.
Way less. All right. The treatment, any pain during the treatment at all, or was it completely numb?
Completely numb.
All right. Good.
As you can tell from my nap that I took.
Yeah. It is impressive that you slept during the treatment. So, all right, good.